Gynecologist, what's the most horrific thing you've ever seen? Bon appetit. A gynecologist here. I do come across unpleasant cases. Girls sometimes walk around for days or even weeks with the same tampon. Necrotic vaginal cancer looks pretty bad too. But none of that comes close to the worst case of my career. One day, a 19-year-old girl came to our clinic complaining that a cap from a hairspray bottle was stuck in her vagina. At first, I thought it was no big deal, but then it turned out she had inserted it at age 15, 4 years earlier. She was extremely embarrassed and could barely explain why she did it. Even before she undressed, the stench was unbearable. When I started examining her, it became 10 times worse. The cap was lodged edge up and had become completely overgrown with vaginal tissue over those 4 years. To make things even worse, it had perforated both her bladder and rectum. We had to perform several major surgeries to remove it. I'm not a gynecologist, but I know someone who recently had a hysterectomy. In this girl's case, there were stitches inside her vagina that needed time to heal. But she couldn't wait to get back to her sex life, so she ignored the warnings and went for it anyway. As a result, her small intestine prolapsed out of her vagina. They told me the story in such detail that I think I'll never be able to eat ground meat again. According to the girl herself, on the way to the emergency surgery, she could feel her intestine lying on her thigh, pulsing. In high school, I had a friend who was terrified of going to the gynecologist. When she finally worked up the courage for her first pap smear, she got so nervous that she clamped the doctor's head between her thighs like a vice. It took her a while to relax and let the doctor go. It was incredibly awkward for everyone. She laughs about it now, but her shyness about her own body never really went away. I'm a medical student. Once I assisted at a hysterectomy. We were told it was a small ovarian cancer, but it turned out to be much worse. The patient's entire abdominal cavity was full of metastases. We spent 13 hours just reducing the tumor volume, though the operation was supposed to take 3. Vascular and general surgeons helped us. We replaced half her blood volume. She had a long and difficult recovery, but eventually she went home to her family. It was exhausting for all of us, but the patient and her family were wonderful people, so it was an honor to help them. I'm not a gynecologist, but I sometimes do exams. Once I removed a tampon that had been inside a woman for at least a month. The funniest part is that she had been having sex the whole time. The smell was hellish. After she left, it took several hours to air out the room. We all wandered around the clinic trying not to throw up. My dad told me about a woman with a severe heroin addiction who, for some reason, decided to inject into her labia. It led to gangrene. I guess the high wasn't worth it. A few weeks from now, I'll be a full doctor, not a gynecologist though. During my gynecology rotation, I was sent to examine a woman. The smell in the room was so bad I was expecting the worst bacterial vaginosis of my life. I started the exam but saw nothing unusual. When I pulled back, the smell got stronger the further away I moved. It turned out her feet smelled absolutely terrible. I highly recommend the book What's Up, Doc? By Dr. Lisa Rankin. There's a whole section about the most horrific cases of her career, maggots, etc. But the best one is about a woman who used a potato as birth control. Since potatoes love warm, dark, moist places, it started sprouting. When she came in, potato sprouts were hanging out of her vagina. I have a story that's not about vaginas, but is equally disgusting. In high school, I volunteered at a trauma center. They brought in a very overweight woman complaining of chest pain. She smelled awful, so the doctor decided to wash under her breast. When he lifted one breast, the stench was so bad we almost passed out. Underneath was a huge infected area. After washing, they found a small hole, and cockroaches started crawling out. Apparently, cockroach eggs had been laid in the skin folds, and when they hatched, the roaches had to chew their way out. My mom told me what I think is the most revolting hospital story ever. A 50-year-old woman weighing 227 kilograms came in. She said her husband had complained about a strange smell during sex. But it wasn't just him. The whole hospital could smell it. It turned out her entire vagina was necrotic. She needed surgery but didn't survive. The worst part is that her husband noticed the smell first, during sex. I'm not a gynecologist, but I've seen some awful stuff. I saw a woman with vaginal cancer, then saw her after complete removal of the vagina and cervix. All that was left was a big open hole that leaked. The poor woman was so devastated she begged her husband to leave her, saying, "After this, you'll never be able to love me." But he stayed by her side the whole time, holding her hand and comforting her. You could see how much he adored her. Another case, a 220-kilogram woman with paralysis of the lower limbs. She had a giant ulcer and necrotizing fasciitis that destroyed everything in the genital and buttock area. Feces were leaking from several spots because her rectum was eroded. She no longer had a functional bladder or vagina, just one big hole. We basically packed it with gauze and hoped she wouldn't defecate during the procedure. She died very quickly. In such cases, we're powerless. I was born with a vaginal septum, 2 openings instead of 1. I only realized it when I tried to remove a tampon. I had inserted it through one hole and tried to pull it out through the smaller one, so it got stuck. It hurt like hell. Luckily, my mom was nearby. She took me to the gynecologist, they operated, and now everything is fine. While working in an emergency room, I saw an elderly woman after a fall. She had a giant vaginal tumor the size of 2/3 of a soccer ball. It was pressing on nerves and blood vessels in her left leg, which is why she fell. I don't know what happened to her after I left, but at her age with a tumor that size, they probably just sent her to hospice. I work as a nurse in a gynecology department. Strangely, we don't see that much horror. Women are usually very careful about their vaginas. The vagina is actually a very resilient organ. The worst case was during a hysterectomy. The surgeon accidentally cut the bowel. They stopped the operation to let it heal, but it didn't. The cut fused with the abdominal wound, creating a fistula. Feces started coming out through the surgical wound on her stomach. She spent 9 months in the hospital with constant infections, wound dehiscence, and hours-long dressings. At one point, the fistula was so big you could fit 2 fists in it. In the end, they gave her a permanent colostomy bag, and they never even removed her uterus. Thanks to all these stories, I'll never again feel ashamed about not shaving my legs or bikini area before going to the gynecologist. A couple of years ago, my friend was an intern in gynecology. A young patient came in with 2 complaints. She couldn't get pregnant and she had constant diarrhea. The doctor asked how often she had anal sex. She said, "Always." Her boyfriend had convinced her that it was easier to get pregnant through the back than the front, so she only let him do it from behind. Another colleague's story. A girl came for an exam. He inserted his fingers to check the cervix, and she suddenly asked, "Have you ever thought this is kind of like stuffing a turkey?" He tried to keep a straight face and said, "No, but now I will every Thanksgiving." The patient burst out laughing, looked him straight in the eyes, and started gobbling like a turkey while his fingers were still inside her. Best Thanksgiving story ever. My grandmother worked as a nurse in a gynecology department for 20 years. One day she came home furious, smashed all the dishes and screamed, "If I ever have to look at another rotten vagina in my life, I'm going to kill someone." The next day she quit. My mom works as a gynecologist's assistant, so I've heard plenty of stories. Once a woman walked in who smelled like a dumpster. It turned out she had been wearing the same pair of panties for 2 months. They were dark yellow-brown. Apparently, no one had ever told her that you're supposed to wipe your ass. My first visit to the gynecologist was very strange. I was extremely nervous and got an old lady doctor. She noticed and tried to lighten the mood. "You're lucky you didn't get a male gynecologist. They don't have fingers, they have thick sausages." Then she stuck her old, wrinkled fingers in me. Thanks for watching. Gynecologists, feel free to write in the comments what's the most horrific thing you've ever seen. Don't forget to check out our other videos. And yes, bon appetit!